Thank you, sir, for the kind introduction and very good morning, respected chairpersons, faculties, all the eminent surgeons here and delegates. Under the tip of the iceberg, what I thought this topic is to inspire young surgeons over here. Before I start my presentations, I'd like to take blessings from my parents, Guru and God, and from Dr. Narasaih sir also, under whom I am presenting this prestigious endowment orations. What normally people see or general public see in any surgeon who is successful is the tip of the iceberg. That's what attracts everybody. But as you see here, the underground is very broad. It is very, very broad. Any surgeon would have undergone a lot of years of training, spent a lot of hours on the training, with dedication, discipline, rejection, stress. Would have undergone all these things before what is colorfully seen at the tip of the iceberg. There have been a lot of turning points in their life which made them successful as a surgeon. I had a very humble beginnings. I did my primary education at places called Sagar and Bhadravati in Shimoga district of Karnataka. I would like to remember these two teachers, Concepta DeCosta Madam and Devara Malya sir, who really framed me as a good student in my primary school days. I was good in studies and I could secure both 13th rank in both 10th and 12th. I shifted to Udupi for my second PhD education. And the first turning point in my life happened was I wanted to be an engineer always, till October. Our final exams will be in March. Dr. Late Sudhakar Rao, who was my biology teacher, used to take special classes in the evening. I never went for any tuitions. So this really inspired me and got me inclined towards biology. I started developing interest in biology and I thought to become a doctor after that. I felt like all these years I wanted to be an engineer, and then finally his teachings, his special classes really attracted me towards biology, and then I joined Mysore Medical College, which is a government medical college and the first medical college in the state of Karnataka, where I was a very mischievous student, but I was good in studies. I used to have a lot of extracurricular activities into sports. And Dr. Shilaji Nayak, who was anatomy professor, and Dr. Raj Gopal, who are microbiologists, maybe on different field, I got very much interested in surgery after an anatomical lecture. I always wanted to be a surgeon during my MBBS days. Second major turning point was in my second year of MBBS, my parents decided to go into spirituality. They started staying in an ashram. I felt very bad at the time because I was just in my second year of MBBS, but the impact of their spiritual incline had a lot of good impact later in my years. So I could realize that in the later part of my life. Finished my MBBS, first entrance examination, I could not get surgery. I thought that let me at least be in a OT. So I took up anesthesia at Nair Hospitals, Mumbai. But the rule was at the time, those who have taken Maharashtra to All India are supposed to join after 1 year. So that was a blessing in disguise. I got married at the same time. Then there was a story of two UKs. Most of our seniors used to go to UK if they could not do well in their first entrance examination, or most of them wanted to go to Kerala for better earnings. Finally, I never wanted to go to UK. I decided to go to Kerala at the time. Then I worked as an RMO there, the registered medical officer in a hospital called the St. Camilla's Hospital in a rural area called as Chungakurnu. The duty was 24/7 hours duty. It was a pain and palliative care hospital. And there I could get some time to study also. And I worked as an RMO there for 1 year. And at the end of 1 year, I could click the entrance examination again, the All India entrance examination. Then I got a seat in Goa Medical College for general surgery. There was no super specialty department in Goa Medical College. That was one of the reasons why I took Goa Medical College, because the exposure was very good. There was only 3 seats in one batch, only 3 people in one batch. So it was a lot of work there. Since there was no super specialty, all the vascular work, the thoracic work, the urology, onco work, everything we used to do. We had only neurosurgery department at the time. The teachers were really excellent. They were totally dedicated to teaching. And I was lucky to have Dr. Dilip Amankar as my guide, Dr. Anand Ramani and Dr. Marvin. It was very, very strict. I was from Karnataka, and the initial period I used to struggle because it was a different state, different work. I was put up in a HOD's unit, Dr. Dilip Amankar, which has to be the busiest unit. Only one in junior resident there, two were senior residents, one was in exam going. So it was a very, very hectic duty, but what I learned there was, I mean, they are very good senior resident. Senior residents were the boss. I mean, they used to give you surgeries based upon how much work you do. And all my seniors, all three senior surgeons were females. So, I mean, I was the first, only one junior resident. My three seniors were senior ladies. So, I mean, all are seniors. They are good surgeons now. I mean, there I learned how to manage things, you know. I mean, the third turning point took place in my first year of MBBS. I had started having severe headache. I thought it to be a migraine, which was not getting relieved. Then I got an MRI scan done. MRI showed an obstructive hydrocephalus, and almost there was a tenterization of the cerebellum. So I was airlifted to Mumbai at Hinduja Hospital, where I underwent craniotomy with excision of the tumor in the third ventricle of the brain. Thanks to Dr. Basant K. Mishra, because I didn't have any of the weaknesses after this major surgery would have hampered my surgical career. And it was a very, very tough. What I always feel is when you get trained, you have to get trained tough. I mean, I developed in my 3 years of residency, I developed the time sense, the sense of urgency. Doing seniors work is very, very important. Most of them hesitate to do seniors work. In turn, I used to get a lot of hands-on training, you know. In turn, I used to get a lot of training. I started working without giving excuses, even though I was married. I mean, I used to always feel myself, who told me to get married before MS? No one. So I have to be as a junior resident, work as other residents, and all my batchmates were 3 years younger to me because I joined MS 3 years after my MBBS. There was no entrance in Goa Medical College. It was a direct entry after MBBS. So I started learning how to stay out of comfort zone. And at the end, I got extreme love and affection because of the work, because of the hard and the sincere work I put in. I was very happy. I thought they made me a surgeon or became a surgeon with eagle's eye and lion's heart, because I got to do a lot of opportunities with hands-on doing MS that I did not do, only anti-resection and Whipples. Rest everything I got to do from senior residents because of the work ethics I had. When I was a senior resident there for 1 year, Dr. Rajesh Patil once had come for a training. There was no laparoscopy in Goa. That just started at Best Institute and Research Center, and he told me that, Ganesh, why don't you go and do training for 15 days? You have done every open surgeries now. I think we have to move ahead with the lab. Can't you come? You come back, get trained, and then we'll start lab in Goa Medical College. I happened to meet Dr. M. Ramesh and Dr. Tulip at Business Global Hospital, Bangalore. The journey started in 2009. Dream begins. I mean, you need not require anybody's permission to dream, but to achieve that dream, you require dedication and determination. So I started dreaming to be a good MAS surgeon. But I had no idea of laparoscopy, no idea of laparoscopic instruments, camera. I do not know how to do a PowerPoint presentation. I did not know how to do a video editing also. I was not inclined to any training programs. In MS, I have never been to any conferences. What I knew was just to work and do a lot of cuttings. Nothing else. I had absolutely no idea. So I was a novice in a new place, and Dr. Tulip was a taskmaster. My batchmates were already doing basic laparoscopic work. They were earning well. I mean, I started, thinking of myself, like there's a very, very long way to go. To be a surgeon. So I thought that not to compare myself with others, just to compare myself how I am today and how I am tomorrow. And I thought to be an expert, because expertise and experience are totally different. So my vision is to be a good surgeon. I thought I have to get ready for many things. I have to pull up my socks, start all over again. But the experience in Goa Medical College helped, because I knew good, fast, open surgery. I was a hard and sincere worker. I knew how to manage, staying out of comfort zone, making use of the available time. I was ready to do every work without any ego or hesitations. I did not know how to give excuses for the work. The learning curve, but in these 3 years, I started holding 30-degree camera for all the cases. Basic work was going on. There's a lap chole, appendix, and IPOM plus. Bariatric surgery was the advanced laparoscopic surgery. That's the only advanced laparoscopic surgery we are performing. I started understanding the angles and spaces of laparoscopy. I started coordinating conferences which Dr. M. Ramesh was conducting. Started coordinating training programs in laparoscopy, which was conducted every 4 months. And under supervision, slowly I started performing lap chole and appendix. I had not done any hernia at all till 2012. I started training Rs and endo trainers modules. But one thing which I would like to tell junior surgeon is, I used to do extensive video editing of the cases which I operated and Dr. M. Ramesh and Tulip operated, because that gave me a broader picture to understand the depth of minimal access surgery, the movements of the instruments, everything in detail you learn when you start editing videos. So I was doing extensive video editing. Every day I used to edit videos, and I started understanding the prerequisites for a MIS surgeon: the passion, the precision, the perfection, and the perseverance. Fifth turning point was when Dr. M. Ramesh, when Dr. Tulip decided to move. So I was doing basic laparoscopic work, laparoscopic cholecystectomy, IPOM plus, and appendix was enough. I mean, I was confused what to do next. Then the entry of Srikanth Gadiyaram to BJS Global Hospitals, renowned GI surgeon. So I joined fellowship in minimal access surgery. It was 1.5 years fellowship under Rajiv Gandhi University of Health Sciences. There I started understanding more and more. I mean, I just understood that surgery is just a part of a field called, operation is just a part of a field called surgery. Decision making before surgery, I started understanding CT scans, the mental preparation before surgery, intraoperative decision making, especially when there is a major bleed, or postoperative when there is a leak. I started attending conferences, CME programs, started presenting in conferences as delegates, started performing laparoscopic TAPP repair and IPOM plus repair. Always I used to work TEP repair. So my graduation is from TEP to TAP. Because sir was more into surgical gastroenterology. And I started holding camera for all cases. I started assisting liver transplants, started assisting renal transplants. But one thing again, extensive video editing. Every day, even sir used to do lap whipples. Within 2-3 days, I used to say, because of the short-term memory, I used to edit videos. So that used to get fixed in my brain. This movement, this step, everything. So extensive video editing was one thing which I would like to stress again. I started becoming more confident of a GI surgeon. My batchmates started commenting me, why do you want to cover all these major cases? We are doing fellowship in minimal invasive surgery. What we want to know is lap chole, lap appendix, and simple hernias. Why do you want to edit videos continuously for such major cases? Are we getting the reference from others after I finish the MAS? But I should just listen to them, because what I felt was anytime, anywhere is a learning, and whatever you learn will never be a waste. One or the other day it will be helpful. So traveling with Srikanth sir, I started learning more and more things, because he started opening more and more things, started understanding the minute details of MIS surgery, which suture material to use when, how to make these movements, how to do this dissection. So traveling with him, interacting with him, I started understanding more and more about the vast field called as an MIS surgery. Even though I was doing a fellowship in just minimal access surgery, I started understanding about GI surgery, the tips and tricks of particular procedures, particular steps, particular movements. Then after I finished my MAS, I joined as a junior consultant in search team. My first presentation was in 2013 as a delegate. I presented about tape repair for a suprapubic ventral hernia, which was very rarely performed those days at Kunur. And I used to travel a lot. I mean, every weekend I used to conduct clinics at Bagalkot, Karwar, Kolar, and Hubli through the hospital. Every weekend I used to be there. So there at Bagalkot, I organized a live operative demonstration where I got an opportunity to perform an IPOM plus. This was my first live operative demonstration in 2013. Srikanth sir decided to have his own setup, Sahasra Hospital, where he's still practicing, so he decided to move. Same time I lost my mother. Again I was confused. What to do? Should I learn? Should I start earning like a freelancing, or should I join some other hospital? Which hospital is going to take me? I rejoined Dr. M. Ramesh and Dr. Tulip at AV Hospitals, Bangalore. 9 years I dedicated at AV Hospitals, where I started as a chief coordinator for training programs. I started performing surgeries in front of the trainees, which increased my confidences. I started going to conferences, attending conferences of Hernia Society of India and IAGS, where I started developing connect with renowned surgeons, started sharing with them, started gaining more knowledge. I was missing GI surgeries of Srikanth sir. So I started watching, I kept on watching the GI surgery videos. Whenever I used to get free time, I never wanted to be away from GI surgery and other hepatobiliary surgeries. So I started watching previous GI surgeries videos. What all surgery videos was pending, I started editing again. Extensive video editing again, so that I am in touch with the surgery every time. So this really kept me in touch with the GI surgeries and all major surgeries. I started performing surgeries, total involvement of work, and I was ready to do anything for the team. And Dr. M. Ramesh and Dr. Tulip gave me a lot of hands-on. With M. Ramesh, the OPD together, everything was together. Traveling together, the conferences, started developing connect with surgeons. My work hour was 6:30 in the morning to 10 p.m. It was consistently for 9 years. Every day, lot of time away from the family, only total involvement of work and nothing else. And this is a major turning point in my life, the 7th. I had a major head injury. On 31st of December, you can know, I had a binge. I was alone at home, 2-3 bottles of beer more, alone at home. A family had gone to a US for a vacation to a sister's place. I was alone at home. I had a fall at home on 31st of December. I had a occipital bone fracture, subdural hemorrhage, subarachnoid hemorrhage. I was unconscious for 6 hours. So it was a near-death experience. God saved me at the time. I was in ICU for 5 days at AV hospital. I started understanding myself more. I started talking to myself. Then I decided, I have to start all over again. It was a mixed feeling of guilt, insult, facing the people again we have seen. It's a mixed feeling. I thought I have to start all over again. My father was my greatest strength. He was staying in ashram at Mumbai, Panvel. He came down. The biggest gift he have given is he believed in me. It was a rebirth. I still call it as a bonus life. So from spirit, the inclination towards the spirituality, I understood myself, understood what I am actually. Then I visited Bhagwan Nityananda Swami Ashram at Thana, Maharashtra. So I was inclined to spirituality in the past 5 years. I understood what is it, what I am. Started talking to yourself. Life gives us tough times, but it all depends how we react to it. And again, I decided to reset, restart, and refocus on what I am supposed to do and not to repeat the old mistakes. I started my clinic exactly 1 year after that. December 29th, 2020, my father inaugurated the clinic. I named it as Guru Kripa because I knew that the restart, refocus, and I have to be a disciple of a guru. And COVID started. And during the COVID waves, mine was the only clinic in the surrounding area which was open. All other clinics were shut down. So I was working in AV hospitals from morning 7 o'clock to evening 3:30. I started doing all COVID duties, started understanding the pathology of COVID, started discussing with physicians. Then from 4 o'clock to 10 o'clock onwards, I used to do work as a GP in my clinic. I started getting a lot of patients in and around Bangalore. So that formed a great database of patients, even though I was treating them for COVID. Then after the COVID, these COVID patients whom I have treated, their relatives were my surgical patients. So that's how I started building my surgical cases started on increasing. I never had a website. Recently, I opened a website just 1 month back. I started getting opportunity to operate in different places. Venkatesh was a OT technician. I have to remember him now. He was my camera person. And there was a very interesting gynecologist called Shweta Dama. She was interested in MCH gynec, so she wanted to run this colorectal dissection of the pelvis and all. So she was my assistant. So all these cases, major cases, I started doing outside because the video editing, where I learned, the camera holding with Srikanth sir helped me. Then again, when you start getting name, I was again started deciding. I was getting offers from corporate hospitals. I decided whether to stay in nursing homes or to continue or to join a corporate hospital, have a own entity. Because ultimately change is the only thing which is constant in life. It was a very tough decision to take to move away from AV hospital where I worked nearly more than 9 years from morning 6 to evening 10 o'clock. It's difficult, a battle between a heart and your brain. The impression before joining a corporate hospital as usual, I was always used to working homes. It will be difficult in a corporate setup. What they look at is only revenue. And training is your passion. So you may not be able to do a training programs the way you are doing here in a corporate hospitals. And there's division of surgical specialties. I don't think so that you will survive in corporate hospitals. But I think I had faced already all these things. And I felt it's an opportunity. What actually opportunity, how it filters. Opportunity comes to very few people. Very few people will realize that it is an opportunity. And in that, very few people will make use of that opportunity and very few at the right time. That's how this opportunity filters. And finally, we feel that I didn't get an opportunity. So it's always realizing that there is an opportunity for you. And I had a huge advantage with me working under Dr. M. Ramesh, Dr. Srikanth sir. I knew, most of the surgeries, I was very confident that I will be able to handle. What I wanted was a platform to showcase my skills. Exactly 1 year after that, I joined a Fortis Hospital, Cunningham Road, as a senior consultant in MS and GA and bariatric surgery with my long-term colleague called B.S. M. Ramesh, Dr. B.S. Ramesh. Again, Ramesh was my teammate. And I had a strong belief that your attitude can change others' attitude. I never went to Fortis Hospital as my job. It was my responsibility. I started working there as my own hospital. I started stretching extra. I was very loyal to the hospital. It was more than a duty of a surgeon, just seeing patient, talk to relatives, operating. I started conducting, I wanted to do everything what a surgeon dreams then. Major lab cases, training surgeons, all these things I wanted to do as a surgeon. So that really inspired me. The support of Mr. Anand Angadi was a facility director there. Within 6 months of joining, I started doing all these major surgeries because I had edited all the videos multiple times. I watched videos multiple times. By the time I matured as a GA surgeon, I did almost major surgeries within 6 months of joining. And this is one story. I never went for training anywhere for an E-type approach. I started watching videos of international and national eminent surgeons who performs E-type. What I always felt was, there was frequent shift of the camera and working ports, a change of 30 to 0 degree scope, and change of working ports. Port placements were based upon the size and site of hernia. I wanted to standardize this procedure. There should not be any shift of the camera or the working port. I wanted to be different. There was no shift of the 0 or 30 degree scope, no shift of camera. So I wanted even the district level or rural surgeons to perform this procedure, and they should not feel that it can be done by only in corporate hospital or surgeons who have these advanced gadgets with their hand. So I started doing this technique, irrespective of the size and site of the hernia. I started standardizing this technique, and I did my first ETP rostopas only in Jan 2021, where others were already doing from 5 to 6 years. So this was a changing moment, and I feel a message to young. It all doesn't depend when you start. It all depends how you start, the way you start, and where you reach after you start. So just to get my work recognized, I started releasing newspapers of the department, started opening my own YouTube channel. I started getting invite in faculties, as a faculty in many national and Asia-Pacific hernia conferences, where I started developing connect, meeting senior surgeons, started sharing with them, gaining more and more knowledge. I started getting invite for live operator demonstration. Consistently, every weekend, I was traveling outside to demonstrate this ETP roostopas technique by a novel 3-port technique. Started asking them that post give me the most difficult case of the conference, because I was so confident of doing that in latter 3-port, and many of the organizers were kind enough to give me the toughest case of the conference. The proud moment, I started training surgeons. Initially, the training was only 5 people. I believed that size of the audience doesn't matter. Now my training program looks like a conference. Almost 155 surgeons attend these conferences now. Most of the trainees have come from abroad also. I started honoring surgeons who helped me in my surgical journey, started inviting past surgical people. I started a fellowship in minimal invasive surgery, and I wanted to prepare the generation next, and I was lucky to get Dr. Marina Thomas, who is here. So I could see myself in her. So she had a hunger to learn, hard work, out of comfort zone. So I thought that my next vision is to make her see doing live surgeries and see her as a successful GA and MA surgeon. I was lacking in publications because once during training program, when Dr. Vijay Borgankar, the past president of HSA, came to my training program, he felt that crossover was the most difficult step, one of the most difficult steps in ETAP. And he told me, why don't you publish this technique? And that was the first time that I have to publish, otherwise I will perish. So this was the first publications which I did in the Indian Journal of Surgery, and Dr. Deepraj, Sarfraz, and Dr. Anil Sharma were my inspiration. And I started doing publications. Every month I started writing 1 or 2 publications in peer-reviewed national and international journals. And ultimately I had 14 publications in a year and 24 in 2 years in all peer-reviewed national and international journals in hernia and GA surgery. Started getting awards, which becomes a part of it. Got the Best Researcher Award in IAGS, then Mahadevan Award from Karnataka. Want to build a team. Dr. Pradeep Chauba and team has been inspiration to all MI surgeons in our country. Had a very good team, have a good team even now also. Got a Center of Excellence from Hernia Society of India. Wanted to be a leader. To be a leader, you have to understand the IQs and EQs of every member in the team. You have to understand that all the 5 fingers are not the same. I started taking Marina and Amol, my teammates, to all the conferences so that they also get connect. I was executive committee member of HSI, now as the vice president of the South Zone. I started giving opportunity to my teammates because even they have to grow in the bigger platform. They started doing well. opportunity to trainees. The trainees who have come to me, they also started getting opportunities, peace of mind. I call my father every day so that what all ahankar or ahamba I receive because of appreciation in the morning, everything has to be zero. The next day, you have to start from the page 1. So this is one thing. I meditate 15 minutes a day. And my father, I called him every day so that I remain grounded again. When Anand Angadi moved from Fortis, we all moved to Kaveri Hospital as a team with the same attitude, but with a greater magnitude. Robot was an additional tool. I started this institute, the brainchild. It was named by Dr. Marina, the Harjaspur Institute of Training. The training started increasing day by day. Every training program, there was 150 students. I started the training courses. The international faculty started giving lecture. Many international surgeons started coming my training program. This is one of the honor where one of my professors of surgery who taught me open hernia surgeries came to me for training for a laparoscopic E-type approach. Again, we got a center of excellence in hernia surgery. Robot initially was not liking, then finally when, because I was doing everything by lab, I thought that what robot will help me more. Then finally I had to develop interest. Now in a span of 6 months, we completed almost all the spectrum of GA surgery by robotic approach. Started working on simulators. Then recently now, work was recognized by Asia Pacific Hernia Society, and we received the Center of Excellence in Hernia and Abdominal Wall Hernia Surgery by Asia Pacific Hernia Society also. A satisfaction as a surgeon. I mean, I could get an opportunity to operate on my father and my professor who was my guide. So I did a laparoscopic left hemicolectomy for him, and my father, I did a laparoscopic cholecystectomy. Because a person who gave you, helped you to join surgery, and the person who taught you surgery. So I could get an opportunity to operate both of them. Mistakes, failures are a part of a surgeon. If a surgeon tells that he has not met with failures, that means he is telling lies or he has not operated much. And I feel bad that patients become the prey to teach us more and more. They have to sacrifice their life to teach us more. So I had a CBD injury, leaks, recurrences and deaths, which feel really guilty sometimes, but is a way forward. You have to forget all these things, learn from your mistakes, and then move ahead. I really regret. I mean, I could not spend much time with the family. Their sacrifice was my support. Their sacrifice was my support, and my father-in-law was a pillar. So I failed in work-life balance. Hope God gives me one more chance to correct myself, because you can never get back the past time. When I was preparing these slides, there were some consoling words for me by Sadhguru, who mentioned there is no such thing as a work-life balance. It's all life. The balance should be within you. So there was some consoling words for me. I felt happy and learned this when I was preparing for this presentation. To conclude, for young surgeons, don't just chase the tip of the iceberg. Build a strong foundation. Build a strong foundation. Work very hard. There is no shortcut to hard work. Work sincerely. Respect your seniors. Learn as much as possible, whenever you get, wherever you get. Don't ever feel that this is not my work, this I should not do it, this work has to be done by others. So everything you work and do, it will be helpful in future. So ultimately, whatever work you do, how much ever effort you put, without the grace of Guru and God, I feel one cannot reach a success. So ultimately, we have judged by the depth we have climbed. I am still a student, learning continues. And again, I thank the chairpersons, all the eminent surgeons here, the entire organizing committee of TG-ASICON to give me an opportunity in this age to present this prestigious endowment oration of the famous Dr. Narasaih sir. Jai Hind.
Thank you, sir, for sharing your journey. It was truly inspiring. I now would like to request the respected chairpersons on the stage to felicitate the speaker.